Hi, my name is Melanie and I am your IVF nurse. This week's topic is going to be about same-sex parenting, primarily with a focus on, say, my two dads. So, I really liked that show when I was growing up, so I figured that's what I'd go with initially. So, what happens is that you and your partner finally decide that you're going to have children. And you think, where do you start? So if your family doctor is, open-minded and you've got a good relationship with them, you may approach your family doctor and say, what can we do and how do we get the ball rolling on this? Now, depending on where you live, if you're in the Toronto area, there is a great program that is held at the 519 Community Center in downtown Toronto. And this program is a 12-week program which is called Dykes Planning Tykes and Daddies and Papas. And what this is that it will give you all the information in this program over the 12 weeks of where to start, how to go about it. You'll be, hearing people speak from different clinics, lawyers about the legalities of it. There'll be, sperm bank representation if that's required. And there will also be nursing representatives and doctors from clinics that are able to answer your questions about their donor egg program and what they have to offer and any fees and all the steps related to getting things rolling. Now, once you've done, say, that program and you've started to think, which do I want to use in terms of donor eggs? So there are a couple of options. There are many agencies where you can have a fresh cycle done. And then they're getting your eggs from the States. So the cycles have already been done, and what you would do is purchase what is called egg lots. And the egg lots can be anywhere from 6 to 8 eggs, depending on which egg bank you're dealing with. And there are quite a few in the States that are able to ship to Canada, so that is always an option for those that are looking at not having, to look at extensive donor profiles or worrying about, is the donor going to take her meds? With the egg banks, however, what ends up happening is that they will ship anywhere from 6 to 8 eggs to you, and then from there, they're fertilized with your sperm or your partner's sperm or both of your sperm, and then you may not end up with 6 to 8 embryos depending on how many eggs you've received. So some people will opt for the fresh donor IVF cycle, which means contacting an agency, which there are agency fees, and then from there, when you're navigating through that process of the agency, you're able to access various profiles of all the donors that they have. So you can search through their 70-page profiles to find out almost anything you want about these donors. So things like where they're at in terms of their education, if they've had children, how many times they've been pregnant, how many egg donor cycles they've done, medical history, activities they enjoy, hobbies, their favorite color, their favorite foods. It's 70 pages plus extensive information on these donors that you can take your time and review. It also includes photos of the donors as well to help determine, what you're looking for, if they're falling into that category of what you want in an egg donor. Now, once you have determined which agency you're going to work with, because there are many agencies out there, it's always good to meet with a reproductive endocrinologist at a clinic that offers donor egg services or can provide donor egg cycles, surrogate cycles. Now, what ends up happening is that you meet with the reproductive endocrinologist, and if you don't have any of the information as yet about egg donor agencies or the egg banks or lawyers, there's counseling involved as well. The endocrinologist, so the first step is reaching out to someone in your community, whether it be your family doctor and being referred to a reproductive endocrinologist, or if you're lucky enough to live in the Toronto area, then getting into the program at the 519 is excellent. So when the doctor meets with the egg donor, he reviews everything that is expected of her, and he may put her on birth control pills, just to be able to time things out depending on her schedule, when she's available, if she's got exams or anything such as that, or if she's got prior commitments for travel, all of that. Now, what will end up happening is that a protocol will be sent to her. So it's very important that, she's got open communication with the clinic, whether it's nurses or the third party coordinator, just to make sure that everybody's on the same page in terms of availability and what's going on, because you want to make sure that your donor does make it for her appointments, and that she's there and she understands everything that's happening to her, in terms of what the medications are used for, what they're going to do, what the procedure is, all of that stuff. Now, once the program gets going, depending on your clinic, they should give you updates as to how your donor is progressing through the cycle. Now, when she is going through the cycle, they may tell you that, oh, she's doing great, she's got X amount of follicles. Follicles are great. However, if you've got an obscene amount of follicles, it doesn't necessarily mean that you're going to have all those eggs that are going to be great and be able to be used. So, going a little bit more gentle with the stimulation will hopefully give you better quality eggs, less number of eggs, but better quality eggs, because if you overstimulate the donor, then you're probably going to lose an awful lot of those eggs to being immature or just not able to be used for the cycle, and then she's at risk for hyperstimulation. So a good clinic with a protocol to minimize the risk of hyperstimulation is also something you want to be looking at. And I know some excellent doctors that have excellent programs where taking care of their donor is first and foremost. Now, once the donor has met with the doctor, even at your initial consultation with the doctor as well, there is tests that are required. I should have mentioned this from the very beginning, because they do take an awful lot of blood, because they have to check for things like HIV, syphilis. They need to do a grouping screen. They want to check your hemoglobin. If you're Black, they want to know if you carry the sickle cell trait or if you have sickle cell. They're looking everything, hepatitis, everything and anything, chlamydia, gonorrhea, all of those things, because it could affect what goes on in the lab. So those tests have to be done, and depending on the clinic you're working with, it's either every 6 months or every year. And it's even the same for frozen embryo transfers. So you want to make sure that you stay on top of any infectious disease screening, as it is required by Health Canada, and clinics are really, really buckling down to make sure that patients are following the protocols to get that infectious disease screening done, because you don't want your cycles delayed. Now, the donor will go through the same extensive testing as well. When she's having her testing done, it's pretty much all the same. Depending on the clinic you go to, they may do urine test for drugs. Now, some of the clinics I've worked with in the past have done the drug testing, and I think it's a great idea, because you don't want your donor literally coked out mid-cycle, and you don't want a donor that's doing this to feed her drug habit. Now, that's not to say that all egg donors are like that, because there are some fantastic egg donors out there that are just so great that I've met over the years, but there have been a few bad ones that not necessarily give a bad name to egg donors, but it's terrible to see or to have to make that call to intended parents when the drug screen comes back and everything's lit up in terms of cocaine or methadone, or these are all things that could potentially affect your baby. So you want to make sure that the clinic you're working with does do random drug screens on your donor as well. I'm a big advocate. You want to have a healthy baby, and that would be initially from the very beginning. Okay, now once all the screening is done and the protocols have been in place and everything's timed up with your egg donor, if you've been lucky in selecting a surrogate, you may be able to do a fresh embryo transfer, and they will sync the surrogate and the egg donor cycle to accommodate that. Now, most clinics will want to freeze everything first and then work on the surrogate, and do frozen embryo transfers. There could be a number of reasons for that. It may be that you found your egg donor and you haven't found your surrogate as yet, and that's fine because frozen embryos can sit for a very, very long time. The other reason may be is that you may want to have genetic testing done on the embryos that are created. As mentioned, with donors, even with heterosexual couples doing egg retrievals, when you're doing genetic testing, the pre-genetic screening, PGS is what we refer to it as, you're still seeing that, maybe 1/3 of those eggs are affected or abnormal with some chromosome abnormality. So that is also another option that's added, but that requires freezing embryos in order to get that testing done in time for the results to be returned back to you so that the doctor can choose wisely in terms of which embryo to transfer. Now, I do know of a couple of clinics in Toronto that are able to have a fast turnaround time within 24 hours. So biopsy is done on either day 4 or 5 of the embryo culture, and then the embryo, depending on the clinic, if it's biopsied on day 4, embryo transfer will be on day 5. If the biopsy is done on day 5, then embryo transfer will be on day 6. But most other clinics will just freeze everything until you're ready to go ahead with your surrogate. Now, with your surrogate, this can be someone you know, it could be someone you found through an agency, and there's a lot of great agencies as well. Screening is required for everyone involved. So if you have selected a surrogate and it's been, say, 6 months, 8 months, or a year after your egg donor cycle and your embryos have been frozen for that time, then expect to hear from the clinic that you will need to update your infectious disease screening before any embryos are transferred into your surrogate. Now, with the protocols for the surrogate, they can range from clinic to clinic. Every doctor has their preference. With the funded program in Ontario, if you're doing funded embryo transfers, that will be just single embryo transfers. Those that are paying out of pocket without any kind of funding will have the option, with the doctor's discretion, to transfer in up to 2 embryos, but that's usually at the discretion of the doctor and how the embryologist grades the embryo and the quality of the embryo and all of that, because ultimately in the end you want to have a healthy baby. And I have met lots of dads to be that want to have one of each at one time. So twins, where it's half the eggs are fertilized with one gentleman's sperm, and then the other half are fertilized with his partner's sperm, and then they're transferring in one of each embryo to their surrogate. So those are ideal situations if that's what you're looking for. Not every clinic will do that because it means transferring in 2 embryos. So you've got to find the doctor who is willing to do that. And I do know of those doctors. Given my employment history, I've worked with many of the doctors in Toronto, so I know exactly where you could go to get what service done and what you're looking for. Now, once your surrogate has had her embryo transfer, she may go crazy in those 2 weeks. Some of the agencies are really great, and they give them like a 2-week wait basket, which I saw and I thought it was a great idea. It gives them like books and DVDs and things for them to pass the time over the 2 weeks, because people blog about the 2-week wait and it is terrible. But once that test date comes up with a positive test, that's ultimately what everybody wants. And we do see an awful lot of that. However, sometimes it's not always good news, and that's the unfortunate thing. And sometimes it's good news initially, and sometimes it doesn't go so well, and it can be very, very sad. But ultimately, you want to trust in your clinic, trust in your surrogate, and just trust in the people who are helping you in your journey. One of my greatest things is that I treat everybody with the idea of how I would want to be treated, and I've met some wonderful people over the years, and it's from every perspective. So healthcare, nurses, doctors, embryologists, lab technicians, receptionists, and even like right down to the patients, where I still talk to them and we're great friends, and I still get photos of their babies, and it's just a matter of having a good support system, getting through it, being able to know what resources are available to you, and being comfortable in your journey, because this is going to be one heck of a roller coaster for you. It's not always, sunshine and rainbows. Ideally, that would be perfect. However, that's not always it. There's always hiccups in the road. There's always something. There's always fees. There's, it always seems like a setback, unfortunately. But do know that we, as healthcare providers who work to do this, we are trying our best on your behalf. And yes, we are busy, and the demand is excruciatingly high, and it is a big deal. It's a big deal to you. It's a big deal to everyone involved, your families, your egg donors, your surrogates. To me, what I find is that when I'm dealing with patients, I think a lot of times they need to know that it's okay to ask the questions. It's okay to ask the nurses, like, can I just ask you one more question, even though you see that she's busy. We do expect that you're going to be asking questions. This is a life-changing situation that you've decided to progress with your partner, or maybe solely by yourself. And having a good support system is very, very important in all of this. The other thing as well is that if you can't get that from your clinic, then it's just unfortunate. And I have heard of patients being kind of rushed through, or not having their questions answered, or they leave more frustrated. So do know that it is okay to ask your questions. If you're finding that you're not able to, or the team that's assisting you in this journey is not receptive to you, then maybe ultimately it's not the clinic that you should be working with. Now, one of the reasons why I am doing this, and I've more or less gone on my own, is just because I've seen it firsthand, where people need the additional time, they need the additional support that they're not able to get in the clinics because of the volume of patients that are going through. So this is how your IVF nurse more or less came to be. But the important thing is, and let's get back on topic here, is that ultimately you want to have a healthy baby or babies, and you want to do this with your partner. And it should be a great thing. And you do need to make sure that you follow every step of the way in terms of crossing all of your T's and dotting all of your I's. There is an awful lot involved. As I mentioned earlier, there is a counseling component. There is the consultation, the infectious disease screening for everybody involved. There is the build-up with the egg retrieval and the stimulation, and then all of the culturing the embryos to blast the cysts. And if you're doing PGS testing, it's like, oh my goodness, how many are we going to have normal, and then having your surrogate to transfer in those embryos to. You want to make sure that you've got a good relationship with her, just because she's going to be carrying your baby. So you all want to be on the same page. So counseling, it's not going to determine whether or not you can proceed. It's just to make sure that you are all on the same page, so that everybody's expectations are out in the open. And it's great to have it done because it opens up a lot of eyes to what's happening, and what's going to happen, and what the expectation is after the baby's born. So all of those things are really, really important. And there are some great surrogate agencies to help you along the way as well. And then you must remember, one of the most important things is the legal component in all of this, because you want to be able to bring your baby home. So this is my topic for this week, my two dads. And if you've got any further questions about donor egg programs in Toronto area clinics or in Ontario, please feel free to reach out to me. My email address is yourivfnurse@gmail.com. I do offer third-party support services, which are listed on my website, www.yourivfnurse.com. Thank you for watching, and have a great day.